everyone. My name is Dr. Bahijja Raimi-Abraham, and I am the FIPWiSE chair. Welcome to this episode of Coffee with FIP, a mini podcast series designed to provide pharmacy professionals around the world with a dynamic platform for informal, evidence-based, and CPD-aligned discussions on key and timely topics in pharmacy that reflect FIP's strategic priorities and programs. Please note that the views and opinions expressed in this episode do not necessarily represent FIP's official position on the topic unless explicitly stated. Welcome to today's episode. This episode is planned around the theme Advancing Sexual and Reproductive Health and Rights Through Pharmacy. And with me today is Shivali Lakhani, a pharmacist, part-time PhD researcher at Robert Gordon University in Aberdeen. Shivali, how are you today?
I'm very well, thank you. And
And
thank you for inviting me to this podcast. I'm really looking forward to having a discussion about sexual and reproductive health with you.
Lovely. And well, you beat me to it. I was about to say thank you for coming on. Being able to just share your thoughts, your experience, your knowledge with people in this format, we're always appreciative. So today, as I mentioned, we're going to be discussing advanced sexual and reproductive health and rights through pharmacy. But before we do that, can you tell us a little bit about yourself?
Yes, sure. So I'm a pharmacist by background. I have worked in community pharmacy for a number of years. I do have experience in other areas such as hospital pharmacy and also in medicines management, and I have worked in GP practices as well. But just very recently, I would say over the last 6 or 7 years, I've been involved in research, and in particularly research through community pharmacy. And I have a role where I support service development in community pharmacy. So in the UK, we're quite unique in terms of we provide services specifically that are from community pharmacy in various areas. And one of my interests is actually in sexual and reproductive health. And here I am.
Thank you so much. And you touched on something there as well, that the role of the pharmacist in the UK is we're involved in so many things and so many services that contribute to public health. And so I think for me, what I'm particularly looking forward to today is sort of contextualizing the role of pharmacy in sexual and reproductive health and rights, because as a pharmacist myself, I'm like, oh yeah, we do stuff, but this is why it's like good to amplify, because I think when you're in the sea of things, you're not necessarily actively highlighting, what we're doing as pharmacists. So before we get into some more, I wouldn't say complex questions, but I think in the first instance, I do love a definition. I can't help myself. So if you don't mind, just tell us, what are sexual and reproductive health and rights? Like, what is it?
It's basically thinking about your well-being for both men and women, actually. So, although when we think about sexual health, we usually think about contraception for women, but actually it involves both men and women, and thinking about having a healthy sexual life and also preparing potentially if that is something that's on the agenda for pregnancy in a healthy manner. And of course, even after pregnancy and even after that, for women, also thinking about menopause and sexual health during menopause as well. It's something that we often don't think about, to be honest, but it's preparing, it's having a sexual health throughout your life, and thinking about all the things that you need potentially to support that.
Thank you so much. So, what unique contributions are pharmacists making to improve? Are you happy for me to use the acronym SRHR? Is
Yeah,
that a
yeah,
common, is that commonly, do people say that
yeah,
conversationally, SRHR? Oh, okay.
yeah.
That's good. Yeah, okay. So yeah, what unique contributions are pharmacists making to improve SRHR services globally?
So quite a few. So I will talk about obviously my experience in the UK, and so I'll start off with sexual health screening. for example. So we provide chlamydia testing. For a lot of pharmacies in the UK provide chlamydia testing, where you could go to the pharmacy and pick up a test kit, and you can and then you can post it yourself, or you can return it back to the pharmacy, and they will post it. And then, depending on the results, if you require treatment would be available from the pharmacy as well. Similarly, HIV testing is something that pharmacies are doing as well. So, for example, you could pick up a test kit. Some pharmacies do it in the pharmacy as well. And again, you would then get referred for treatment depending on the outcomes of the test. So that's a couple of things that are happening quite widely in terms of sexual health screening. Then I'll move on to contraception. So community pharmacy in the UK recently have been really kind of proactive in this space. For example, the contraception service is available now nationally. So it's something that's funded nationally. And what that means is that you can go to a pharmacy, certainly in England. It does vary a little bit in the developed nations, I have to put that caveat in. But I'll talk my experience from England because that's where I work and live. And what you can do is you can go to a pharmacy and you can get your oral contraception. So women could go to a pharmacy and get oral contraception. Now, this could be something that could be initiated by the pharmacy as well. So if you've never had oral contraception and you're thinking about what your options are, you could go and have this discussion at the pharmacy. If you're already on oral contraception, then you can get further supplies from the pharmacy. So that means that you don't actually have to go to the GP and get your prescriptions from there. The other thing that pharmacies are also doing is emergency hormonal contraception. So if you're in that situation where you require emergency hormonal contraception, again, that is part of the service now, certainly in England, where you could get that and you can get advice and you can think about all the options that are available to you. And that includes thinking about long-term contraception. So, for example, there will be discussions about LARC, which is the long-acting reversible contraception. And although pharmacies are not fitting that currently, it is something that we do talk about as an option for women, and then we would refer them to a sexual health clinic, or if their nurse is providing that in their GP. That's a long-term contraception method if that's something that's suitable and preferable by the client. The other thing that pharmacists also do is condom distribution. So there is a service that's available and where certain age groups can come in and pick up free condoms, and they have what we call a C card. So they just show the C card, and then very discreetly, they don't even have to reveal their true name. They can call themselves whatever, we wouldn't know, their actual identity, and they could come and unpick that up, which I think is, something really, really useful in terms of preventing, pregnancy as well as sexually transmitted diseases as well. So that's under the contraception. And then my PhD actually is focusing on preconception care. So I'm going to bring the angle of preconception care. So we always think about preventing pregnancy, but actually we also need to think about pregnancy preparation as well. So thinking about, what is required for a safe pregnancy. So in the UK, 8 out of 10 women go into pregnancy with risk factors. And these risk factors could be things like obesity, existing conditions, for example diabetes, hypertension. It could be that they haven't taken folic acid. So folic acid is something quite essential to be taken during that period of planning for pregnancy. So these are all things that community pharmacies are doing at the moment, but it is kind of haphazard or ad hoc, you can say. So it's not happening all the time. It tends to happen when people actually ask for advice, from the pharmacy team. So this is all going on. So we can provide advice on the medication. We can review their medication, for example, to kind of ensure that they are safe if they were to become pregnant, and to manage, existing conditions like I've mentioned, diabetes, for example. Also, smoking cessation is another thing that pharmacies do support and provide services often, and again, advice is given in this space. And then finally moving on to, so I've almost gone to the life course really. So I've gone through the whole life course, and now moving on to menopause. So during menopause, we know that many women experience vaginal dryness that affects their sexual health. And so in the UK now, you can buy vaginal estrogen, which is available over the counter for a certain age group. So there are restrictions and things, but again, that is something that pharmacies are supporting and providing currently.
Thank you for giving that overview, and it's I like as you said, you're taking us through the life course, of needs as with sexual and reproductive health. I think for me, what I also liked in what you're saying is what came to me rather in what you're saying is almost ensuring that there's dignity throughout the whole journey. Um, a random fact, one of my early jobs when I was a student was working in a shop called Ann Summers.
Okay.
And yes, and it's I mean it's a fine conversation, but because Ann Summers, the nature of the shop, you were finding that you would get, and it just so happened to be I was a pharmacy student, right? So I'm learning and I'm in that, in that environment. But actually, you found that a lot of women came to Ann Summers or whatever to ask for advice because there wasn't that opportunity in that same way from community, from not, I wouldn't say just from community pharmacy, but in healthcare in the community. So I think being able to just hearing the journey and how visible these services are, it's not a taboo. It's a safe space for people to get what they need. I think that's really important. I was also particularly interested in the work you're doing in your PhD. The sort of, as you said, it's not all about preventing pregnancy, but what about supporting when people want to get pregnant? And so, yeah, I think that's really interesting. I like how you linked all the different services around that.
Thank you. It is quite a lot that I think pharmacies are doing, but as you said earlier, they don't really think about it that, oh, I'm providing this, oh, this is classified under this. And, a lot of the things that I mentioned around preconception care, they are doing it, but currently it's a bit fragmented and, there's not a set service as such for it.
Yeah, definitely. As you were talking, it made me reflect on my own practice. I was like, oh yeah, I do that. That's okay, that's true. And yeah, it was really good. And so we've highlighted the fact that particularly with community pharmacy globally, I would say, just from my own experience, is the central healthcare for literally the community. People tend to come to their pharmacies first before they go anywhere else. And so I guess my next question would be, how can pharmacy settings, and you can make that either just more focused on community pharmacy settings, how can they be optimized to support comprehensive and equitable services in this area, SRHR?
Yeah, absolutely. So you mentioned sexual, you mentioned the fact that pharmacies are, the hub of the community. People come into actually a pharmacy often. Often they're well. They're maybe just coming in to do a bit of shopping, get their shampoos, toothpaste, or whatever. We're quite unique in the sense that we see people who are well, and we can do a lot of preventative healthcare, but also we see people who may not be well and may be coming in for other things as well. I think a key thing is that pharmacies are open long hours, certainly in the UK. They can be open, quite long hours, late into the evening, weekends. So is that accessible, or accessibility, I should say, of pharmacies? And I think that often doesn't get utilized as much as it can. So just comparing it to the sexual health clinics, often they're not open, in the weekends or evenings. There's also this, from reading in the literature, there's also this stigma potentially attached to going to a sexual health clinic. Whereas when you walk into the pharmacy, you could be walking in for anything, as I say, simply buying something, for example. So nobody's going to know you've gone into a pharmacy to perhaps get advice about your sexual health or something that you're concerned or worried about. And I think this is a very unique kind of point, and that makes it kind of a place for people to go in, have a chat. But then also at the same time, certainly in the UK, we have a lot of pharmacies now have a consultation room, and so that could be something that could be utilised a bit more in terms of providing more kind of sexual health services that might require a room, that might require for you to, actually maybe administer something, or, give something, or test something. So in-house testing could be something that could be done a lot more, and this could be optimized for sure. For that, we would require some, national funding. So we have got funding for certain services, like I mentioned, the contraception service, but a lot of the other services that I mentioned, for example, HIV and chlamydia, they're all locally funded models. So actually, that is a bit of a postcode lottery, to be honest. So you could be in an area where all of these services are available to you, but what happens if you're in an area that that's not available, and you might have to walk for miles or travel for miles before you can actually access these services? So actually, providing and making it available more widely through pharmacies would, provide that, support that inequality that's actually going on currently. Also, to provide this, training would need to be available for pharmacies, because currently they provide services which they, obviously are trained for. But if we want that to be widely available, we would require much more training to be going on, and actually to involve the rest of the pharmacy team as well. So not just the pharmacist, but actually to involve, pharmacy technicians, for example, to involve healthcare, staff as well. And all pharmacies in the UK are healthy living pharmacies, and actually have a health champion. And what that means is that they're very familiar with public health priorities such as sexual and reproductive health. And making every contact count is something that we need to really kind of make more use of, actually, because that's how we're going to create that awareness that pharmacies are able to provide these things, and the public can then feel comfortable in the knowledge that actually they're trained, and we can go in and get this support from the pharmacy.
Thank you so much. I mean, I agree with everything you said. I think it was on point. Something that did just pop into my mind.
Yeah.
See how we've seen the role of the pharmacist expand in terms of so when we talk about the services in terms of, vaccines and vaccinations and so forth. Do you think there's scope, and this doesn't have to be for the podcast, I was just talking, but do you think there's a potential that one day maybe the pharmacist could be involved in delivery or implant, like the implant, long-acting hormonal therapy? Is
Yeah.
that something that there's potential for that, or is that even happening now?
It's not happening now from what I've experienced or seen. However, it is one of the next tiers in the contraception service. So when the contraception service was launched, initially we were just doing continuation of therapy. Now we're initiating, and the next step is actually providing LARC. And for that, certainly we would require training. It's something that is quite niche, specialized, and as I mentioned, the consultation room would obviously be something that we would need to make use of. But yeah, that is definitely the future. That is something where I think pharmacy could really support with the right training, as I mentioned earlier.
That puts such a smile on my face because just seeing, I think for me personally, I'm a very proud pharmacist, and I always feel happy when I can see that others, when I say others, just let's just say globally, people, powers that be are appreciating the value that we add. So to hear that actually the next tier in supporting sexual and reproductive health and rights is to have the training, and you're completely right, we need that training in place, but to support with LARC is beautiful because it just shows the progress of the profession, but also the value add in supporting public health services as well.
Absolutely. I think years ago we would not have dreamed of doing these types of services or providing this kind of care
Yeah.
to our community. And yes, I definitely think the future is looking bright in that respect.
That's the quote for the whole episode. The future's looking bright. My last question, really, it sort of ties in what we've just discussed anyway, but in what ways can pharmacists support the delivery of comprehensive SRHR services in both community and clinical settings?
Yeah. In the like I mentioned in the UK, we have I've mentioned the use of the consultation rooms, but also something that's happening, and it's a big progress, is that actually pharmacists are now going to be, well, a lot of them are actually prescribers. So we can prescribe now, within our scope of practice. But I feel that this is actually not being utilised so well in a community pharmacy setting. And that is a huge kind of area that if efforts were made in that area, perhaps, especially in sexual and reproductive health, that could be utilised much, much more. In terms of community pharmacy and clinical settings, I think a lot of pharmacists do work in GP practices, and a lot of those are prescribers. So they have that available, that is kind of already mapped out currently. So they are prescribing, but I haven't come across very many that their scope of practice is actually sexual and reproductive health. A lot of them are in other areas, for example, hypertension and diabetes, because these are really important priorities, just in general. So I think there could be a bit more kind of push, perhaps, to encourage, these prescribers to expand their role into sexual and reproductive health. So that's an area that I think something definitely could happen. Another thing is that currently pre-exposure prophylaxis for HIV is only available in clinics or private online pharmacies, which you need to pay for quite large amounts, if you were to buy it yourself. Perhaps that's something that could be available through pharmacies, and especially if prescribers are going to be working more and more in a community pharmacy setting, that could be something that could be utilised a lot more in this area. And I think that goes back to the, equity angle. Again, you can only get that through a couple of channels, and that's it. So what happens if you can't access those channels? So this could really be a way forward, in my opinion, for PrEP. And things like other sexual health services, like I mentioned, chlamydia testing. Again, that could be widely available. Currently, we work under what we call a patient group direction to give out treatments. However, as prescribers, they would be able to more, expand, and give out other things if needed, for all, conditions. Also, vaccination, we mentioned. Hepatitis B could be something that could be, more widely available. Pharmacies are already doing vaccinations in, other things, COVID, flu, everything, all of those. Maybe perhaps expanding it to hepatitis B is also an angle that could be pursued, I think. There's also a lot of women who are not attending for their smear tests, for their cervical, screening. And perhaps community pharmacy could be a support for that. So the women who are not attending, perhaps having a conversation with them about, what are the barriers. Could they perhaps pick up the home testing kits? So I'm not sure how efficacious they are or whatever, but that is something that's in the pipeline coming through as well, for women who are actually scared of going into clinic and having that done. And we've already discussed LARC fitting. I think that's a really key area, and that could actually happen currently in a clinic settings as well, but more so going forwards. I think that's definitely something that needs to be, community pharmacy could support. And then my favourite topic, which is preconception care, because of my PhD, I have to bring that in. Having a service where potentially women and men actually, could access support for pregnancy preparation, I think community pharmacy is an ideal place for that. But I'm biased, of course, a bit like yourself. I'm, a pharmacist. So, but yeah, that could be an area, that pharmacies could definitely support. Um, but I think the kind of wider thing we need to also think about is these are places where pharmacy can support and there's a lot of potential. But how do we embed these services? I think that's a really important kind of thing to consider. So, in the wider multidisciplinary team, how could we perhaps have pathways in and out, I would say. So, referring into pharmacy, and for complex cases, pharmacies can refer out to specialists to, for complex, cases, for example. And that is quite an important thing that needs to kind of happen for pharmacies to make all these contributions and to kind of be embedded within the wider network.
Thank you so much. And yes, I'm glad we're joint in our biases around how amazing being a pharmacist is. But um, so many things that you said that I completely agree with. And I think that making sure there's sufficient infrastructure for inclusion of pharmacy within the workflow of, providing services for sexual and reproductive health. I think that's the key point, isn't it? Because we don't want as pharmacists to just be in silos. We want to actually be embedded in the workflow for patients. And I mean, we may have you come back on to talk about your PhD topic, particularly because I have a podcast called Monday Science, and I did a whole series on female and male reproductive health with a particular focus, interestingly enough, on preterm conception and the importance of it was from a female perspective, so the importance of a woman preparing her body for the physicality of carrying a baby, things like cardio fitness and things like that, which is all lifestyle, lifestyle considerations that some people don't necessarily think about as well. Well, we've unfortunately come to the end of I think we could talk forever, but I'm gonna ask you maybe if there's any key messages or anything you would just like us to take away from everything that you've said today, if there's any just one last thought that you want to share with us.
I think the last thought would be that pharmacists can do a lot, and are willing to do a lot actually, just from my own experience as well. But the support, as you said, the support needs to be there. The infrastructure, both within the pharmacy as well as externally. Outside the kind of being part of the wider multidisciplinary team, and then we can contribute to sexual and reproductive health throughout the life course. So yeah, that would be my final thought.
Thank you so much, Shivali. You've been an amazing guest. Thank you for listening to this Coffee with FIP episode. Please check out the FIP website for more resources and episodes.